let us talk about type 2 hypersensitivity reaction. This is cytotoxic. Okay, so type 2 is a cytotoxic hypersensitivity. So here the concept is that it is mediated through IgG and sometimes IgG plus IgM mediated. Okay, now this is directed against cell surface antigen, extracellular matrix, and exogenous antigen absorbed on the cells, such as drugs on the RBCs. Okay, so it is IgG plus IgM mediated. It is directed against cell surface antigen, extracellular matrix, and exogenous antigens absorbed on the cells. What are the target antigens here? Here the target antigens are RBC membrane such as ABO-RH, basement membrane, and the drug-coated cells. These are the target antigens here. Okay, targeted antigens. Then what is the mechanism in type 2 hypersensitivity? One mechanism is a complement dependent reaction. Okay, so what you get, antigen antibody complex, there is a classical complement pathway. Okay, but antigen antibody complex is primarily mechanism for type 3. Okay, this is one of the mechanism in the type 2, but primary antigen antibody complex is for in the type 3. Okay, so one of the mechanism here is a activation of the antigen antibody complex leading to the activation of the classical complement pathway. So once these antigen antibody complexes are formed, the complement pathway will get activated, and the outcome will be either cytolysis, then inflammation, or the opsonization. Cytolysis is mediated through C5 to C9. There are membrane attack complexes are formed. Okay, then C5 to C9 complexes will lead to the cell lysis. C3A and C5A will lead to the inflammation. There will be neutrophil recruitment, and you will have C3-5A and C5A complement. Okay, that will responsible for inflammation, and the opsonization is from C3B and C4B complement, and that leads to the phagocytosis. Okay, so from examination point of view, you remember C5 to C9. These are the membrane attack complexes. So MAC is formed from the C5 to C9, and that leads to the cell lysis. Okay. Then C3B is opsonization. So C3B and C4B is opsonization. C3A and C5A is anaphylotoxin plus chemotaxis. Okay. So these are the chemotaxis. Then examples, you should remember examples of all 1, 2, 3, 4. Okay. So transfusions reaction is a type 2 hypersensitivity reaction. Okay, transfusion reactions such as ABO incompatibility, RH incompatibility like erythroblastosis fetalis, autoimmune hemolytic anemia, drug-induced hemolysis, and pemphigus vulgaris. Okay, now second mechanism. One was a complement activation. Okay, antigen antibody complex formation and the complement. That was one. Second is ADCC, that is antibody dependent cellular cytotoxicity. So that is another mechanism. Here IgG binds to the antigen via FAB portion. The FC binds with the NK cells, and that will lead to the target cell destruction. Okay, so this is ADCC, antibody dependent cellular cytotoxicity. This is another mechanism by which this type 2 type of hypersensitivity will present. Okay, so here IgG binds with antigen via FAB portion. The FC binds with the NK cells, and that will lead to the red cell destruction. It is used for parasite, tumor cells, graft rejection. Okay, so graft rejection is also type 2 type of hypersensitivity. Okay, sometimes there is IgE, especially in eosinophils such as parasites. Okay, so here also sometimes IgE is responsible, but it is a type 2 type of hypersensitivity if it comes to the parasite and not the type 1. Okay, so here from examination point of view, remember it is a too large to phagocyte, that is ADCC, antibody dependent cellular cytotoxicity. So here actually these immune complexes are formed. So actually here whatever the complex they are formed, they are too large, and phagocytosis is difficult, so it leads to the antibody dependent cellular toxicity. Okay, so there is a target cell destruction here. Third is auto antibody mediated dysfunction. Okay, auto antibody mediated dysfunction. Antibodies alter receptor function. Okay, so there is no destruction, but antibodies will alter receptor function. This is present in autoimmune condition. Okay, so there may be two types of things which can happen. So there will be antibodies. They are altering the receptor function. This receptor function may be activated or may be inhibited also. Okay, So this is activation is seen in Graves' disease, where these autoantibodies, they will stimulate the receptor and there will be secretion of the thyroid hormone. Okay, these are LATS antibodies. Okay, long-acting thyroid stimulant antibodies. While in myasthenia gravis, these autoantibodies are inhibitory. They will act on the receptor, they will inhibit the receptor, and they will block the ACH receptors. Okay, so this is ADCD. Okay, that is antibodies directly change the receptor dynamics. Okay, so these are the antibodies which are directly changing the receptor dynamics. They may activate it, they may inhibit it. Okay, in Graves, there is a stimulation, that is go signal, while in myasthenia gravis it gives a stop signal. Okay, so other important examples, Goodpasture syndrome, you should remember. Here there is an anti-type 4 collagen, antibodies are against the anti-type 4 collagen. So this is the example of type 2 type of, and this hypersensitivity. Pernicious anemia, where there are antibodies against the anti-intrinsic factor. In rheumatic fever, there is a cross-reactivity with other antibodies. And Chagas myocarditis is also another example of type 2 hypersensitivity. So just from examination point of view, it is mediated, type 2 is mediated via IgG or IgM. Then cell destruction or dysfunction is there. Mechanism is either via complement or ADCC or receptor effect. Okay, so that is about the hypersensitivity reaction type 2.